Thank you very much, Linda.
Thank you. Now, this is Cancer Awareness Month, so this is the first program that we're going to do in April. So I thought we'd start off by talking about prostate health.
Great.
And prostate cancer. And I think we need to kind of talk about the difference. But let's start off a little bit by first of all saying what exactly is the prostate gland?
Well, the prostate, imagine the prostate gland as a little walnut inside the body, at the bottom of the body, and the prostate gland looks like a donut or a bagel. Now, through the bagel hole, through the donut hole, is the ureter, and it connects the bladder to the outside world through the penis. So the prostate gland is important because all the urine goes through the middle of it. Now, as the prostate gets larger, like benign prostatic hyperplasia, what happens is the whole donut gets bigger and the hole suddenly gets smaller.
Okay.
So now instead of having a very large hole through which the urine can go, we have a very tight hole and the urine has a harder time getting through.
So is this sometimes like when we hear about an older gentleman who might talk about not being able to go to the bathroom at night and different things like that? And I know from dealing with prostate cancer and screening that we do hear those concerns from time to time.
But that's not the only problem we have. Some men have prostatitis, which is an inflammation of the prostate caused either by an infectious process or a non-infectious process. Sometimes we had a bladder infection that can cause the prostatitis, or instrumentation like cystoscopy. Or sometimes the gland itself gets large, backs everything up, and causes an infection too. So these are the causes of prostatitis, and it hurts. It's painful. Best treated with antibiotics, sometimes with an anti-inflammatory agent, sometimes with a good old-fashioned Epsom salt sitz bath.
Now that's interesting because I think the message, as I'm hearing you, is that, hey guys, just because you're feeling some of these conditions that Dr. Simone just spoke about doesn't necessarily mean it's prostate cancer.
Not at all.
Okay, that's a good thing.
Yeah. Then the benign enlargement, the prostatic hyperplasia, which we talked about with imagine the donut or the bagel. By age 30, 10% of all men have it. By age 60, 50% of all men have it. And by age 80, 90% have it and causes symptoms by that time and increases the cancer risk. What are those symptoms? Again, imagine the donut hole getting smaller. The urine has more problems getting out, so you have more frequency. You have to go to the bathroom more often. You feel like you never emptied the bladder that well. And the urinary stream is very, very small and skinny. And that's the problem.
Okay, if I'm listening to you, by age 30, men start to maybe develop these things. Maybe they don't notice it right away.
That's right.
But if a man lives long enough, might he have some of these conditions?
Yes.
And yet that doesn't necessarily mean prostate cancer.
Exactly.
It's just a prostate health issue.
Process.
A normal aging issue.
And you can treat this benign hypertrophy, this benign hyperplasia, with simple herbals like saw palmetto, carnitine, and even pygeum. They're very effective to treat it. Also, men have other problems. Sometimes after age 44, 60% of all men have an enlargement of their breasts, usually the left side more than the right. And that's very common, very nuisance. It's a nuisance, but it's common. And finally, they can have erectile dysfunction. Very embarrassing, but caused by lots of things, including medications, antihypertensive agents, antidepressive agents, antipsychotic agents, neurological, vascular problems, medical problems, things like that.
So I think as I'm listening to you, because some of these other things that can cause some of these side effects or dysfunctions in males is sometimes a result of other medications or other things going on in your body.
Over which they have no control. Right.
They have no control, but it also speaks to the fact, and I always say this, and I hope you guys are listening out there, stay in touch with your physician.
Yeah.
And if you see these things, we need to bring it to their attention.
Exactly.
Because there are things that can be done.
And we'll talk about that, too.
Go ahead, Dr. Simone.
Let's talk about prostate cancer. The African-American male in the United States of America has the highest rate of prostate cancer in the world.
In the world.
In the world. They have, of every 100,000 African-American men, there are 137 getting prostate cancer. That's a huge number. Compare that to the Chinese people. When they get 2 men of every 100,000 over there. 2, when you look at the African American compared to the white U.S. Citizen, there's 101 men, white men get prostate cancer as opposed to 137. So African American lead the pack, and they really have to be watched over carefully. Canada, Norway are right in the middle, and Los Angeles Japanese Americans have a high rate because they're around 47 men per 100,000. Now, how's that important? When you look at the people in Japan itself, they have a rate of about 11 per 100,000. So it's not a genetic thing, but rather it's what we're doing to ourselves in our country that is causing most of our problems.
And somehow, Dr. Simone, I know this is going to end up at diet and nutrition.
We're getting there, Linda.
I love
We're
it.
getting
Okay, go ahead.
1 in every 6 men get prostate cancer. Now, that's a big, big number now. It has risen from 1 in 20 just only a few years ago, 1960. Now it's 1 in 6 men, and that number is zooming up higher and higher and higher.
Is there a reason for the increase?
There's a couple reasons. I think that the major reasons we're using more of this PSA, the blood test.
Okay.
So we're finding more cancers than other countries will because we use the blood test more often. But we're also abusing our bodies as well. And we'll talk about that, how to prevent it.
Okay.
The key thing now is, can we change the mortality? Can we increase the lifespan of the patient who has prostate cancer? Because what we've seen so far, from 1920 to the present time, we've not changed the lifespan of a patient. So in other words, a man who gets prostate cancer today will live about as long as a man who got in 1920.
Oh, okay.
And that's despite all the chemotherapy, the radiation therapy, the immunotherapy, and all those fancy things. And again, we've published all that information in our book, The Truth About Prostate Health, Prostate Cancer.
Now, is there some reason that the numbers haven't been better?
The major reason is we can't find the cancer soon enough, early enough to make a difference. And we'll talk about that.
So once again, early detection.
Early detection and prevention is most important.
Okay.
Now, what do we know? The major causes of prostate cancer and colorectal cancer, because they're kind of similar, is nutritional factors. In fact, 60% of women's cancers and 40% of men's cancers are all related to nutritional factors. So we have total control. Genetics is only responsible for about 7% or so of the people with cancers of the prostate. So we have control over this. We have a lot of control.
Okay.
And let me just bring up one more thing, one myth that lots of people think about all the time. There's absolutely no link between developing prostate cancer and the frequency or infrequency of ejaculation.
Okay.
So that's a big myth that lots of men have a hang-up with.
Oh, okay.
How do we detect it? Well, the long and the short is there are 2 methods that we have. The digital rectal exam, which is by far one of the most common things that are done. However, only 30 to 40% of the nodules of the abnormalities that we feel turn out to be a cancer.
Well, that's a good thing.
That's a good thing. So most of the abnormalities we feel in the rectal exam are not cancer.
Okay.
Great majority are not. What's next? We have a blood test. Our country has discovered it, the PSA, prostate-specific antigen. It's a simple blood test, very easy to do, and it finds cancers pretty well. About 30 to 40% sensitivity. So it's not a great test, but it's a good test for what we do. So between the digital rectal and the prostate-specific antigen, the blood test, it's a good combination to look for cancer and early detection.
Now, I just want to ask you one thing, because I know we do the PSA blood test. Is there a difference in the men? If a black man gets it done, is there a different level?
The normal level for a white man is 0 to 4.
Okay.
The level for an African American is 0 to 3.5.
Okay.
So if it's over 3.5, start looking around for a problem, because they have a earlier problem with a lower level.
And what about how early a black man should have it done? I just want to emphasize that.
The usual recommendation for all men is around age 50 or so. The African Americans should start in their late 30s, early 40s.
Okay.
In that range. And they should really be diligent about it. There's no harm, no shame. It should be done.
Okay.
Now, we know that a small change of 0.75 units over a year's time is an indication of a cancer if it's rising.
Okay.
So it's very important. Now, what could cause a PSA elevation if it's not cancer? Lots of things.
Oh, okay.
So not all elevations are cancer.
Okay.
Let me just go through a few.
Go ahead.
Benign prostatic hyperplasia. When the gland gets big, if the gland gets bigger, it's going to have more of a PSA. So that's one thing. Prostatitis, an inflammation of the prostate.
Okay.
Bike riding. Anytime you irritate the bottom part of the man's body, you're going to have an elevated PSA. Marathon running. How about a digital rectal exam? So a digital rectal exam should be done first on a man, and then the blood test should be obtained, not the other way around. And anything else mechanical, like any manipulation, can do it as well. Now, the PSA is an important predictor of who's going to have cancer or not.
Okay.
If the PSA is around 7, now these numbers are pretty good. If they're around 7, it's probably not a cancer, but maybe hyperplasia only, except for an African-American man. That man needs to be biopsied. If it's around 12 instead of 0 to 4, which is normal, the cancer is probably confined to the prostate. If it's greater than 10, 75% of the time there will be a cancer detected. And if it's greater than 100, the cancer has spread beyond the prostate gland. So the number is relatively important. So how do we make a diagnosis? We need to biopsy it. That's the only way to make a diagnosis. You need to biopsy it. It's a relatively simple procedure, relatively painless overall. And again, no shame involved. If the PSA is elevated above 3.5 for an African-American male, it has to be biopsied.
Okay, Dr. Simone, we're going to take a break right here.
Good.
Because, first of all, I know there's a lot of information. We're just going to take a quick break. We'll be right back. We're talking about prostate cancer and the truth about prostate health, and we'll be right back. This is WIMG AM 1300 and WZBN Channel 25. And, of course, you can always find us on the World Wide Web at WIMG1300.com. We'll be right back. We are back. This is In the Public Interest. My name is Linda Johnson. I'm your host this evening. And my guest this evening is Charles B. Simone. He's a researcher, doctor, immunologist, radiologist, and Dr. Simone's been on with us several times. Dr. Simone.
Thank you, Linda. You know, I misspoke in our last segment. I said something wrong. You need to do the blood test first before the digital rectal exam, because the digital rectal exam by itself will increase the PSA. So the blood test before the digital rectal. Otherwise, if you do a digital rectal, you need to wait at least 2 whole weeks before you take the blood test.
Well, I love it. He never makes mistakes, folks. So I'm very happy to see he was gallant enough. Okay, Dr. Simone, now, what are some of the prevention strategies that men can do to help waylay some of the prostate?
We developed a 10-point plan. We developed it in 1980, and the 10-point plan will really go to speak to the issue of prevention. And also, if a man has a prostate cancer or even a colon cancer, you can actually increase the lifespan of that patient too. Let's go through it.
Okay.
We know that 60% of all cancers of women and all men's cancers, 40% of men's, are diet-related, so we need to change our diet. First of all, we need to avoid four-legged animals, shellfish, and dairy products unless they're skim or non-fat. Those 3 things are important to do. What do we have left? We have 2-legged animals, chicken, turkey, swimming fish from the ocean only, not the farm, and everything that grows from the earth.
Okay.
So that's everything, and that really addresses the whole thing. In addition, we should take vitamins and minerals. Our food supply today is not what it used to be in 1975. The USDA published a study in 2005 showing that we have less nutrient capability in our foods, anywhere from 14% to 400% less vitamins and minerals content in our foods compared to 1975. So we need to take a vitamin and mineral supplementation. We also should be taking a calcium-based supplement, not only for your bones, you've all heard about that, but calcium can decrease the risk of colon cancer and breast cancer in women too. And finally, we should all be taking an aspirin if we are medically able to.
Okay.
Why? It decreases the risk of heart attack and stroke, but importantly, which are a major cause of death in all people, especially African Americans, but also it decreases the risk of spread of cancer if you have it or if it's not available yet, not known yet. So those things are nutritional supplements, and aspirin should be used as supplements. What else? Smoking.
Oh.
It's silly to even talk about it at this point.
But say it anyway.
You can't smoke, you can't chew, you can't snuff.
Okay.
However, how many people know that involuntary inhalation causes about 17% of all our lung cancers, particularly when you inhale it between the ages of 3 and 15, when you have no control over your life? So that's a big deal. It also increases the risk of prostate cancer and breast cancer independently.
Okay.
Alcohol, big problem. 2 or 3 glasses a week are enough to increase the risk of prostate cancer by a factor of 180%, independently of everything. So if you're drinking this much alcohol, 1.5 ounces of whiskey, 4 ounces of wine, 12 ounces of beer, they're all the equivalents of each other. You need to decrease that dramatically. 2 or 3 of those units will get you in trouble, almost 180% higher.
Okay.
Walking. We're sedentary people in our country. We need to get out there and start walking, start
Physical
working.
activity.
Got to. If you can do that 20 minutes by the clock, 4 or 5 times a week, we can decrease the risk of cancer in general, colorectal included, as well as enhance the immune system. And finally, we're going through the 10-point plan real quickly. Finally, we know that if you change your mental attitude, decrease stress, you actually increase the immune system.
So does that tie in with spirituality?
Yeah, the 4 ways I tell patients to do it, one of which is hot water. We all take showers, all take baths. Use it therapeutically. Secondly, music, the kind you like. She may hate it, somebody else may hate it, but if you like it, it'll calm your brain down. And finally, spirituality. Spirituality, people who are spiritual are more at ease, they have less diseases, and there's less progressive issues of their disease. So these 10 points will do a number of things. They'll enhance the immune system. They'll actually decrease the risk of cancer in general, specifically prostate cancer, specifically colorectal cancer. They're hand in hand. The 2 cancers are all diet related. So if you decrease the fats, you'll decrease the risk of cancer. And at the same time, they'll not only prevent these cancers or lead to a prevention, but they'll also increase to a lifespan that's longer in men who already have these illnesses.
So you're saying that it's a prevention strategy
It is.
as well as a life-extending strategy.
Exactly right, for those who have the cancer.
That's wonderful. Now, Dr. Simone, I know you spoke at the beginning about the African-American man and the risk factors.
Right.
And can you maybe speak, are there some of the, I know diet plays an important role. Are there any other risk factors that African-American men should not do or do as opposed to Caucasian men?
No, you know, the risk factors are the same.
Okay.
The problem is there's a higher rate, perhaps, of fatty foods, but probably not the case. We're all subject to a high-fat diet in our country, higher obesity. All these factors have a big part in causing the cancer of the prostate or simply the enlargement of the prostate gland as a benign hyperplasia. So we can help reverse that. Let's just review again the diet because that's so important. You need to avoid the 4-legged animals. And I say that, and we kid about it, we joke about it. The children remember it.
I know.
We all remember it. But it's real. If you can avoid the 4-legged animals, you're really home free. Because that's where all the fat is. That's where all the cholesterol is. If you avoid the milk products, you're also doing a great job. You can drink skim milk, eat skim milk products, non-fat yogurt, non-fat this. But don't forget, dairy products are everywhere. They're in things like pizza. We don't think about dairy when we eat a piece of pizza. How about chocolate? That's all dairy. So we're eating these fatty foods all the time, and it's one thing after another, and included the shellfish. Shellfish are loaded with fat, loaded with cholesterol.
Are you talking about crab?
Crab, anything that has a shell.
Mm.
Lobster, shrimp.
You're breaking my heart.
Well, just remember, 4 legs, shellfish, and dairy. Those 3 things, just remember that. Everything else is fair game. It's good. But make sure the fish is coming from the ocean. The fishes that are raised in the farm are 4. Catfish, tilapia, salmon, and trout. Avoid them because they feed those fishes the same stuff that they feed the 4-legged animals on the farm. So you need to avoid it. In addition, you need to avoid things in our everyday beverages. For instance, benzene. Benzene is a horrible chemical that causes leukemia and lymphoma and adds to a causation of many of our other cancers. Benzene now has been found in 80% of all diet sodas. Outrageous, 80%, at a higher level than any drinking water. Benzene also is found in drinking beverages that have 2 things in it, vitamin C and benzoate. Those 2 ingredients, by themselves, they're fine.
Okay.
But when they're put together, benzoate and vitamin C, they form this evil benzene.
Now, I know I've gone to your website, and if I'm not mistaken, you have this on your website,
That's
this
right.
information. So, for those of you who are listening out there, if you go to Dr. Simone's website,
Which
tell
is
us what it is.
drsimone.com, drsimone.com.
Then we can find out about the benzene thing, because that, when I read that, that was amazing to me.
Yeah, that's.
I only found one thing on there, though, that I didn't drink. That that I do drink, and I cut it out right away. So we know that we have that on your website,
Right.
and we can look that up. Is there anything else you can leave us with?
Sure. We have a few minutes. What
Yes.
we'll do is let's talk about people who have early stage prostate cancer
Okay.
and how they should be treated.
Okay, treatment options.
The American Urological Society has reviewed over 12,500 papers, and they concluded that no one treatment is better than the other for early stage prostate.
Okay.
So one treatment option is simply do nothing, observe it. One treatment option is to do radiation of any form, seeds or external beam. Another form is surgery, remove the gland. And another form yet is to freeze it out with liquid nitrogen. And they found that there's absolutely no benefit in one over the other for lifespan. Now the costs are staggering. Observation, if a man just chooses that, there's virtually no cost. If a man chooses radical prostatectomy, it's about $20,000. Radiation with seeds, $12,000. Radiation with an external beam, about $13,000, $14,000. Using the new fancy technique IMRT, almost $50,000. Cryosurgery, $13,000. And the bottom line, according to the studies, 12,000 studies, the bottom line is no change in the lifespan for any of these options.
And it doesn't matter perhaps what stage of cancer?
We're only talking about early stage.
Early stage.
Only talking about early
Okay.
stage. So with early stage disease, there's almost no change in lifespan for any of these options that men choose. So they need to feel comfortable with what they choose because,
Okay.
they've been conditioned to believe that maybe one is better than the other. So unless they feel comfortable with that, they should make the choice according to their comfort
So
level.
once again, it becomes empowerment.
That's right.
And everything you
Knowledge.
told us, knowledge is power.
And that's what we have in here, the book, The Truth About Prostate Health, Prostate Cancer.
Wonderful. And Dr. Simone is local here in the Trenton area, and he's been a guest on the show here at WIMG several times, and we love him to death because I'm telling you, if you don't want truth, you can't come here because he's going to give it to you straight. Dr. Simone, thank you.
Always
I want
a
to
pleasure.
thank you
Thank
for being
you.
a guest.
Thank you, Lynn.
Now, as usual, it is, I like to do announcements because there's always something happening